Hello, and thank you for joining us. I'm Sandy Potter, alongside Masonicare President and CEO, JP Venoit, and Dr. Ronald Schwartz, our Senior Director for Continuum Health Services. We're checking in with you once again as we all work together to help prevent the spread of coronavirus. And Dr. Schwartz, this past Monday, Governor Lamont announced that Connecticut will continue implementing an age-based approach for the distribution of COVID-19 vaccines, and he released a schedule of eligibility. In some ways, this plan breaks with CDC recommendations. What are your thoughts on this decision?
Well, it's definitely been an eventful week, Sandy, and we're making very good progress with vaccinations. And I think one of the key messages that I'd like to say is that we just have to vaccinate as many people as possible, as quickly as possible, and keep the momentum going. And that's what's going to help us stay ahead of this pandemic. There's some quotes that Governor Lamont made. I'm just going to read a couple of why he's taking an age-based approach to the vaccine availability. And he wrote, "In an effort to ensure that Connecticut continues taking the most equitable and efficient approach to quickly administering the COVID-19 vaccine to as many people as possible." He also said, "We found that risk was highly correlated to age and that it was very complicated to pick and choose between different exceptions there." And again, I agree with a lot of these points. I think the goal is to try to get the vaccine forward as much as possible. As a doctor, there are important considerations to think of as well, as far as different morbidities, mortalities, conditions, and so forth, which are important to be recognized. There's the schedule, just in case people haven't heard of the schedule, I'll just read it to you briefly, but it's going to be planned over the next several months. So for example, March 1st would be age groups 55 to 64. March 22nd would be groups 45 to 54. April 12th, 35 to 44, and May 3rd, 16 to 34. So I think the thing to note, is that this definitely is different than CDC guidelines, and I think it is in an effort to try to vaccinate as many people as possible, as quickly as we can in the midst of a pandemic. I think the quote that I'd like to say for this week actually is, "Dream as if you'll live forever, live as if you'll die today." And that actually came from James Dean. And if you don't know who James Dean was, he actually was an actor, a young actor who made a lot of movies in the 50s. One of my favorites was Rebel Without a Cause. But ironically, he died at age 24. He was racing a car, and I guess he lost control, as I understand it, and he died. But the reason that I picked this quote this week is that, so many of us now want to really live like we can live forever, because we're so tired of being isolated and not traveling and not seeing families and relatives and so forth. And I think we're getting closer each day. We're moving along, we're making progress, but I think we still have to remember basically the diligence of wearing masks like we do, and the social distancing, washing our hands, avoiding, large crowds, and still avoiding travel, and most importantly, making sure we get vaccinated. And I think if we continue to do this, we'll continue to move forward and get control of our lives again and have quality of life back. So just to say, I thank everybody for all the hard efforts and everything that you're doing, and wish you health and peace.
Thank you so much, Dr. Schwartz, as always. And JP, here at Masonicare, we're cautiously optimistic as we begin to reopen many common areas for residents to enjoy once again. How are all those plans going?
Sandy, thank you. I will tell you that the plans are progressing along very well. All of our communities are establishing really reopening or re-energizing plans for our residents. And each community is a little bit different based on where they are in regards to geographical area, and also what they're seeing even within their community. But visitation is starting to relax in certain areas. The nursing home is still not allowing visitation inside as of yet, but it is anticipated over the next week or two that we will see that loosen up based on following the CDC requirements. As far as residents within our residential living side, we're starting to see opening of the dining room, starting to see some activities and things of that nature. But, you know, I want to caution everybody, we are going to take it slow. As much as everybody wants to see us open up and get in and really be able to go back to some normalcy, what we don't want to do is open too early to have to close down very rapidly because of a potential outbreak or an outbreak. So we want to do everything we can to keep our residents, patients, and clients safe. So we are really taking it very slowly. And I hope everybody understands it's really in the best interest of everyone that we're serving, because the last thing we want is to have one of our residents unfortunately come down with this terrible virus. So we are working very diligently in that. I will say that visitation in certain areas actually is happening now, more on the residential living side. But even at that, it's still restricted and limited in its acceptance. I do want to thank all of our residents who, the majority of our residents have gotten at least their first shot. And I will tell you, a good portion of them have already gotten their second shot. So our residents are essentially almost fully vaccinated, which is truly amazing when you think of all of the residents that we serve each and every day that have already gotten their vaccination. And I'm happy to say a large portion of our staff have gotten at least the first dose also. So we are progressing along very well. And we do have a mandatory requirement for all of our employees to have it by June 15th. And I'm happy to say we have a large portion that have already done it. And if you think about it, this vaccine, one, allows us to get to some normalcy, but there's reasons why we did it. Why did we get our vaccine as employees? It's really to make sure that our residents, patients, and clients are safe. We're doing it for them. We're doing it for our family. We're doing it for our friends. We're doing it for the community. That's what it's all about. And I think when you look at the numbers of vaccines that have been administered here in Connecticut, over 800,000 have been administered. That's a large amount. And it truly shows that by doing the vaccinations, we can get back to some normalcy. So those opening plans become a whole lot easier to do when we see the vaccines happen the way they are. So I think we're seeing that light at the end of the tunnel, and it's actually a bright, shiny sun of normalcy.
That's fantastic, and we're certainly very proud of our entire Masonicare family for leading by example.
Absolutely.
Yes. Well, thank you both so much for sharing your time with us and all of this important information as always. And thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.